As Nigeria joined the rest of the world to commemorate World Cancer Day, the federal government have reaffirmed its dedication to enhancing access to cancer care across the nation by announcing plans to establish 6 new cancer centers equipped with brachytherapy machines and other essential equipment in each of the country's 6 geopolitical zones. The Coordinating Minister of State for Health and Social Welfare, Dr. Tunji Alausa, in a press conference in Abuja, said that the initiative is aimed to bolster the country's capacity to diagnose, treat, and manage cancer effectively, ensuring that patients receive comprehensive care regardless of their geographic location. Here's a detailed report on that.
The World Health Organization has projected that without prompt action, cancer-related deaths in Africa could reach approximately 1 million per year by 2030. It also noted that within 2 decades, cancer death rates in Africa are expected to surpass the global average of 30%. One of the strategies the federal government of Nigeria said it is employing is working to close the care gap of cancer burden in the country by addressing the disparities in access to cancer care services and improve health outcomes for all Nigerians. The Coordinating Minister of State for Health and Social Welfare, Dr. Tunji Alausa, at a press conference in commemoration of World Cancer Day in Abuja, said the federal government has provided strategic guidance to the National Health Insurance Authority to enroll cancer patients into health insurance schemes, thus reducing the cost of cancer care and enhancing financial protection for affected individuals and their families.
The Ministry of Health will continue to provide its oversight and policy direction for the fund. The National Health Insurance Act of 2022 has made health insurance mandatory for all Nigerians. We have also provided strategic guidance for National Health Insurance Agency to enroll all Nigerians, including cancer patients, into their health insurance. This will go a long way in reducing the cost of cancer care in the country. Vaccination for viral hepatitis has been on the national program on immunization. Human papillomavirus vaccination was commenced in October of 2023. I hereby enjoin parents, opinion leaders, and indeed all stakeholders to take advantage of the immunization program. The vaccine is free, very safe, and highly efficacious in preventing these cancers.
The WHO country representative to Nigeria, Walter Kazadi Mulombo, on his part, called for collaboration and partnership among stakeholders to implement robust cancer care programs effectively.
It's a long-term effort, and they require the right commitment at both levels. Politically, the government, the community themselves, they need to be better aware of the risk of cancer, and the private sector. So it's really an all of society undertaking. And WHO and other partners, we are raising that awareness, supporting the country, but updating the policy direction, using the evidence we collect so far, and monitor.
Also speaking, the president, Nigerian Cancer Society, Adamu Al-Hassan Umar, and CEO, Partnership for Eradication of Cancer in Africa, Salomi Eferemo, spoke on the need for early diagnosis, the treatment, and management of cancer effectively.
Another very good solid news that came out from the ministerial press briefing today is the issue that the National Health Insurance Authority Act that makes health insurance compulsory on all Nigerians will be fully operational very soon. And we're also very happy to note that the minister categorically made a statement that cancer will be included as part of the insurance cover.
They should routinize the checking of women for cervical cancer by the cheapest means of it. They call look and treat. That is the layman's language for it. It doesn't cost more than 2,000 to 3,000 naira to do that, basically, in a primary healthcare center. But if it becomes a policy in the country, all those women who were not captured from 2007 when the vaccine was discovered and has been in use in the world, we can capture them when they come into the hospitals. We can check them early and then we can treat them.
The minister, however, disclosed that there is ongoing collaboration efforts with various pharmaceutical companies to review the cost of cancer chemotherapy with some international non-governmental organizations.